Good afternoon and welcome to sunny San Diego. Once again, I'm your host, Dr. Nicholas Alohi, and I'm here with Dr. Anshu Gupta, MD, plastic surgeon. Doctor, welcome on the show.
Thanks for having me.
Of course. So, Doc, tell us a little about yourself, about your schooling, your residency.
Yeah, sure. So I actually grew up in India and did my medical school there as well. Came here in 1998. Did some 3 years worth of research in gene therapy, and then did my general surgery residency first. It was a satellite program of UCSD in Bakersfield. After that, I did plastic surgery at Indiana University, and then came back to San Diego to start my practice.
That's wonderful.
Yeah.
So, we know plastics is a very wide range of practice. As it relates to the personal injury world, what are some of the things you've seen and some of the surgeries that you do?
So in personal injury, most of our cases come like scar evaluations or scar treatments. What happens, and like dog bites is a pretty common example as well. So what happens is dog bites or fresh wounds, sometimes you can't stitch them up. The chances of infections are high. So initially they just let them heal on their own. So most of the initial scars end up healing thicker, wider, and they need some kind of treatment later on. So that's what I see very commonly. But then we also see cases, ruptured breast implants, for example.
Okay, that's a good one.
Yeah. Or
That's right. That's actually very. It's not common, but it does happen. I've seen
Yeah.
a dozen of them with high impact injuries.
Yeah, yeah.
Yeah.
And especially with the seat belts. So, and sometimes it's not the rupture, but what happens is if there is significant trauma to the implant, the scar tissue around the implant gets very thickened, called capsule contracture, and that can displace the implant. So, implant can have malposition and the breast doesn't look right. So it doesn't necessarily have to be an implant rupture. It can just be an injury causing the misshaping of the breast.
And how do you evaluate that? Is it visual? Is it diagnostic? How do you evaluate the thickening and the capsulitis?
So visual and palpation. So you
And
can
palpation.
feel they are typically more firm,
Got it.
and then you can see the implant being not in the right position, typically much higher up.
Wow.
Yeah, and then there are no true studies that will show you capsulitis, but the exam is very easy and kind of it confirms the diagnosis.
Well, I learned something new today, and that is very. I mean, you just think about breast augmentation is extremely common, and with these high impacts, and it's something that even the attorney's clients or certain doctors' patients don't even notice because they don't put two and two together.
Exactly.
But that's something really really big to look at because you think about. I mean, I don't know what the statistic is, but depending what part of town you're in, it's probably 50-50 when it comes to breast implants, if not more.
Yeah.
That's when we have to send to Dr. Gupta to do an examination. That's interesting. Now, Doc, do you do any type of you do scar revisions? Do you do any fractures in facial fractures?
So I used to.
Okay.
Most recently, I've not been doing actively, but here and there, some primary care doctor sends like orbital fracture or nasal bone fracture and stuff, and we'll do those.
Okay,
sure, yeah.
so orbital fractures, possible deviated septums, nasal fractures,
Yeah.
those are stuff that we see,
Yep.
especially in the traumatic brain injury world, where it's it's the head face type of traumas.
Yep.
So anything in the face, let's say we have. I mean, obviously not any type of like retinal detachments, but let's say we have lacerations,
Yeah.
right? So eye lacerations, which is big, forehead lacerations. Those are the things that you treat.
Yeah, absolutely. And sometimes it's not the actual laceration that's active right now, but it has been repaired. But in the face, even a minor misalignment, for example, the brows may not be aligned or the lip border may not be perfectly aligned,
Excellent.
and it shows right away.
Right.
Face is one of those structures where if things are off, the other person will notice that. It's
Wow.
very presentable feature. So we have to kind of revise those.
Right.
So that's where we come in.
That's great. And doctor, what locations you have?
So I'm in Encinitas,
Okay.
so which is North County in San Diego.
Okay.
Um,
And where do you operate?
So I operate at a variety of places, at Sharp Hospital
Okay.
near downtown, and then up north, Scripps Encinitas, Scripps La Jolla, and all the way in Oceanside to Tri-City Hospital, and then I have a couple of surgery centers.
Fantastic. So, Dr. Gupta in San Diego, taking care of our scars, lacerations, wounds, orbital fractures, nasal fractures. Very, very important in some of the clients or patients we get in. Dr. Gupta, I want to thank you for being here. And always an advocate. Really appreciate your time. We'd love to see you again.
Absolutely. I'd love
Okay.
to come back.
Love to come back to San Diego. And thank you again for tuning in. On location, Dr. Nick in San Diego. Gonna get in my swim trunks and take a dip. All right. See you later.
Hi everyone, I'm Danae Jones, your local representative for Global Financial Partners, the one-stop shop for all your funding needs. I'm excited to connect with you today and pleased to always support the incredible work you all do in the personal injury space. I'm also proud to share that Global Financial Partners sponsors PI Today podcast, helping bring valuable insights and medical education to our community. And don't forget to like, comment, follow, subscribe, and share this episode. See you all next time.